Assalamu alaikum students. Now I am telling you about the antidepressant drug. The types of depression. According to DSM-5, depression is characterized into different types depending upon the presented features. Depression having the types of atypical depression, postpartum depression, catatonic depression, seasonal affective disorder, and melancholic depression. The pathophysiology of depression. The pathophysiology of depression includes the different types of receptors, which includes the antidepressive pathways involved the monoamines, noradrenaline, and 5-hydroxytryptamine, which act on G protein coupled receptors and the brain derived neurotrophic factor BDNF, which act on a kinase linked receptor, switching on genes that protect neurons against apoptosis and also promote neurogenesis. This is a pathophysiology of depression. Stress related and glutamate, what does happens in the hypothalamus, what has happened in the pituitary, and what has happened in the adrenal cortex. There's a high level of cortical release when a person is depressed. Okay, this is a pathophysiology. The noradrenaline having the alpha 2 receptor, the 5-HT have the 5-HT1A receptor involvement, and the BDNF involves the TRB, which means the kinase linked receptor involvement. There is a signal transduction pathways which includes the detrimental gene transcription response, which comes from the adrenal cortex when there is increased level of cortisol release, and the beneficial gene transcription response. The detrimental gene transcription response leads to neural apoptosis and results in depressive symptoms, while the beneficial gene transcription response results in the neurogenesis and resulting in the depressive symptoms. Traditional antidepressant drugs. The antidepressant drugs includes the inhibitors of monoamine uptake, monoamine receptor antagonist, monoamine oxidase inhibitors, which is said to be MAO inhibitors. Then the inhibitors of monoamine uptake are the selective serotonin reuptake inhibitors, which is also called SSRIs, classical tricyclic antidepressant, which is also called TCA, newer mixed 5-HT and noradrenaline reuptake inhibitors, and the noradrenaline reuptake inhibitors. Traditional antidepressant drugs and their characteristics. Type and examples, action, unwanted effects, and the risk of overdose. Number first is monoamine uptake inhibitors, which includes the SSRIs. SSRIs includes the following classes, which includes the fluoxetine, fluvoxamine, paroxetine, citalopram, escitalopram, and sertraline. The action is all highly selective for the serotonin 5-HT, inhibit the reuptake of 5-HT. Unwanted effects that these drugs produced are nausea, diarrhea, agitation, insomnia means less sleep patterns, anorgasmia, inhibit metabolism of other drugs, so risk of interactions. Risk of overdose includes low risk in overdose but must not be used in the combination with Mao inhibitors. Number second class is the classical TCA group, which includes the imipramine, desipramine, amitriptyline, nortriptyline, and the clomipramine. The action mechanism of action of these drugs are the inhibition of noradrenaline and the serotonin reuptake. Unwanted effects are the sedation, anticholinergic effects like the postural hypotension, seizures, impotence, interaction with the CNS depressants, especially alcohol and MAO inhibitors. Risk of overdose includes the ventricular dysarrhythmias, high risk in combination with the CNS depressants. Number third is other 5-HT reuptake inhibitors include the vinalfexine, which is a weak non-selective 5-HT uptake inhibitor, also non-selective receptor blocking effects, whose unwanted effects are the weak non-selective 5-HT uptake inhibitor, also non-selective receptor blocking effects, and the risk of overdose means no potential risk. Another is duloxetine, which is a potent non-selective 5-HT uptake inhibitor, no action on the monoamine receptors, and the fewer side effects than phenylphexine, sedation, dizziness, nausea, sexual dysfunction. The risk of overdose includes the low risk in overdose but must not be used in the combination with Mao inhibitors. Another class is bupropion, whose mechanism of action is the selective inhibitor of Na over 5-HT uptake but also inhibits dopamine uptake converted to active metabolites, for example, redoxifexine. Na is a noradrenaline. Okay, the unwanted effect it produced are headache, dry mouth, agitation, insomnia. Seizures at high doses is a risk of overdose. Another is the meprotilene. Meprotilene is a selective noradrenaline uptake inhibitor which act as a TCA, no significant advantages as, and the side effects are like that as TCAs. Another is a reboxetine. Reboxetine side effects are the dizziness, insomnia, anticholinergic effects. The risk of overdose is the safe in overdose, low risk of cardiac arrhythmias. Another class of antidepressant drugs are monoamine receptor antagonists, which is the mirtazapine, which block alpha 2 5-HT2C and the 5-HT3 receptors, whose unwanted effects are the dry mouth, sedation, weight gain. Risk of overdose, no serious drug interactions. Another is the trazodone, which blocks the 5-HT2 and the 5-HT2C receptors as well as the histamine receptors. Weak 5-HT uptake inhibitors enhance noradrenaline 5-HT release. The unwanted effects are the sedation, hypotension, cardiac dysarrhythmias. The risk of overdose are no potential risk. Myansarin, which blocks alpha 1, alpha 2, 5-HT2A and the histamine receptors. Unwanted effects are milder antimuscarinic and the cardiovascular effects than TCAs, agranulocytosis and the aplastic anemia. Another is Mao inhibitors, which is the phenelzine, phenylcopramine and isocarboxide, whose mechanism of action are same like non-selective Mao inhibitor, inhibit both the Mao A and the Mao B. Unwanted effects: cheese reaction to the tyramine containing foods, and cholinergic side effects like the hypotension, insomnia, weight gain, liver damage rarely. Risk of overdoses are many interactions of TCAs like opioids, sympathomimetic drugs, risk of severe hypertension due to cheese reaction. So cheese should be avoided with the Mao inhibitors. Another one is the meclobemide, which is a Mao A selective short acting. Unwanted effects are the nausea, insomnia, and agitation. The risk of overdose is the interactions less severe than with other Mao inhibitors. No cheese reactions reported.